So as we move into personalized therapy for urothelial cancer, we hope to refine our ability to determine which patients respond to treatment. That will be particularly important as we develop additional downstream strategies so we know how to best treat our patients. The goal of this paper was based on some of the early data suggesting that FGFR3 alterations were associated with immunologically cold tumors. And those immunologically cold tumors typically had a luminal-papillary subtype. When we looked at patients enrolled on the clinical trial, over 90% of patients were of luminal-papillary subtype, and we were curious, could that subtype help us predict which patients would respond better to erdafitinib compared to those who did not respond, since the objective response rate was around 40%. So what we found looking at this review of luminal papillary subtype, we saw that the response rate was very similar with erdafitinib, regardless of whether they were luminal papillary or not. So we couldn't use this luminal papillary subtype to help refine information on determining which patients would benefit the most from erdafitinib. We do have additional goals, looking at additional pathways associated with response. Could some of those pathways predict or enrich for patients who need erdafitinib the most? But you'll have to wait for additional data because work is ongoing.